Well, welcome everybody. We're so happy that you're here with us tonight, and we appreciate you taking time out of your busy schedules to learn a little bit about what we do at Southwestern. I'm going to focus my brief introduction on some of the newer technologies, specifically the lasers that we use in our practice. We're very fortunate. We do live in an ivory tower, so we get to try a lot of new devices. As Dr. Rourke had already mentioned, a lot of times we try the devices before they're released, and sometimes they're not even released based on some of the work that we do. But there's a lot of hype surrounding lasers, and there's been a lot of hype for many years. And as Dr. Rourke had mentioned, the kind of the buzzwords these days are lasers and stem cells. So one of the myths that I'd like to talk to you about is the use of lasers and light-based energy to tighten skin. I think we've all seen the advertisements for this office-based procedure that's going to tighten the skin, or this laser device that's going to tighten the skin when you have your fat removed. And I think the bottom line is you have to be very careful with what you read, because there's not a lot of objective science or a lot of objective data that really supports that. So when you start to hear about claims that don't sound like they could possibly be true, then you have to question that. And I think the way that we question that as physicians is we look for science to back it up. And when whether you're talking about laser liposuction or lasers to tighten the skin, there's just not good science to support that. So be very cautious about that. And I would never promote any laser in my practice as a skin tightening device. So that being said, we do have a lot of lasers in our practice, and they do a lot of good things. They do everything from remove tattoos, remove unwanted hair, they remove blood vessels, whether they be on your legs or on your face. They can help improve the texture and the color of your skin, and even help with some of the wrinkles in your skin. So there's a lot of good uses for lasers that we have in our practice, and most of those we actually do in our office, so they're office-based procedures. Depending on what your goals are may depend on how aggressive we get and what kind of downtime that you're going to have with those procedures. So again, usually what we do, if you're interested in specifically facial procedures, when you see one of our doctors, we're going to bring you in, we're going to talk to you a little bit about what your goals are, we're going to talk to you about skincare, because that's going to be an important part of what we do. You'll see one of our estheticians with one of us, and then we can come up with a plan. And ultimately the plan is going to be dependent on what your goals are and how much downtime you're willing to accept, and then based on that we can factor in what would be the best treatment. It may just be to use good skincare products and over time see the results, or it may be to do a little bit more aggressive procedure.